Hello friends, this is Dr. Anand Kishore. In my last video, we learned the common myths about viruses in general. I hope you liked the video. This time around, it's high blood pressure, commonly known as hypertension. Hypertension is the most common non-communicable disease in the world today. More than 1 billion people suffer from it worldwide. The problem is, most of the people are in a denial mode. They refuse to believe that they have a disease. Most of the myths about hypertension are about finding an excuse not to take medicines. Non-compliance leads to irreversible consequences which add to the overall morbidity and mortality. Hypertension is regarded universally as a silent killer. It targets your kidneys, your eyes, your heart, brain, and blood vessels. There is a dire need for medical education for patients, irrespective of their level of education. This video is not about the detailed medical information about hypertension. This video will outline the misconceptions and myths about high blood pressure, which will hopefully prepare the patients to go in for right kind of a medical management, which will positively impact their life. So, what is hypertension? Simply put, when the pressure in the arteries is persistently elevated, either by increased resistance in the arteries, by narrowing, or by cholesterol clogging, and as a result, the heart has to work overtime to meet the oxygen demands of body. Coming to the classification of hypertension, is of two types. One is essential hypertension, where no cause is known, which accounts for almost 95% of the cases. This means only in 5% of the cases, the actual cause of the hypertension is known, which is called as a secondary hypertension. And the possible causes of secondary hypertension could be CKD, that is chronic kidney disease, renal artery stenosis, that is narrowing of the kidney arteries, endocrine disorders like Cushing syndrome, hyperthyroidism, pheochromocytoma, birth control pills taken over long periods, smoking, tobacco in any form, excessive salt in diet. These all can cause secondary hypertension. What are the diagnostic criteria for diagnosing the patient as having hypertension? They keep changing all the time as per the newer studies. Gone are the days when it was considered to be a rich people's disease. There were times when people would make a social statements like, "Look at me, my blood pressure is 200 by 120. As per the latest norms, normal blood pressure is 120 by 80 millimeters of mercury. 140 by 90 millimeters requires lifestyle modifications, and more than 140 by 90 requires medical treatment along with lifestyle changes. Let us start with the myths. Myth number 1. High BP only impacts those over the age of 40 years. The truth being, high blood pressure risk increases with age, but people can develop hypertension at any time. Enter fast food, trans fat, sedentary lifestyle, no exercise, and you have a perfect recipe for hypertension at any age. Nearly 1 in 5 young adults have hypertension. Hypertension generally affects men more than women. The truth being, it doesn't have gender predilection. Both are equally affected, or maybe it is slightly more common in men. Another myth being, if you feel fine, you don't have hypertension. Far from true. More than 1 billion people worldwide have hypertension, but 1 in 6 have no idea. You can feel fine with hypertension. This is why it is often called the silent killer, because someone with no symptoms can suddenly have a heart attack or a stroke. It's a major cause of premature deaths all over the world. Myth: if you don't salt your food, salt isn't a big issue for you. The truth being, most salt in food isn't added at the last minute from your tabletop salt shaker. It is processed into the food during manufacturing, especially for canned goods, soups, tomato products, and condiments. Check labels constantly and look for words like sodium, soda, and abbreviations Na, which are all variations in salt. Human kidneys are not efficient enough to expel excess amount of salt from the body, and hence it is retained in the body and causes osmotic changes. While as in sea animals like fish, the excessive salt is thrown out via kidneys and gills. There is another myth. Wine is good for the heart, so drink as much as you want. Well, limit consumptions to 2 drinks per day or 12 ounces of beer. This doesn't give you a license to start drinking. Even with this small quantity, your heart might be okay, but your liver might show the signs of derangement and you end up getting cirrhosis. Myth number 6. If you inherit hypertension, there is nothing you can do about it. The truth is, while it's impossible to prevent inheriting it, you can manage hypertension with lifestyle changes. Exercise, eating a low salt diet, maintaining a healthy weight, and avoiding alcohol and smoking can have a positive impact on your blood pressure. Another myth being, when medications brings your blood pressure down, you can stop taking it. Absolutely wrong. Never stop taking your medications without consulting your doctor. Hypertension can be a lifelong disease and you may need to take medications every day for the rest of your life. People with high blood pressure have nervousness, sweating, difficulty sleeping, their face becomes flushed. I don't have those symptoms, I'm good. The truth is, many people have high blood pressure for years without knowing it. It's often called the silent killer because it usually has no symptoms. You may not be aware that it's damaging your arteries, your heart, and other organs. Taking medications to control my blood pressure causes more harm than good. Truth is, it is true that medications can come with side effects, but that doesn't mean that everyone taking it will experience them. Rely on your doctor. If you have side effects, you will change your medicines. Why should I bother even if my blood pressure is high in the pregnancy? You could either have gestational hypertension or preeclampsia. Gestational hypertension is easier to treat. Preeclampsia is a condition where along with hypertension, patient passes proteins in the urine. Preeclampsia occurs in about 5% of pregnancies and is responsible for approximately 16% of all maternal deaths worldwide. Preeclampsia also doubles the risk of death of the baby around the time of birth. Usually, there are no symptoms in preeclampsia and it is detected by routine screening. Doesn't matter to me even if I don't get treated for hypertension. The truth is, you might land up with hypertensive crisis if your blood pressure shoots up to 200 systolic. There could be stroke, myocardial infarction, or renal shutdown. There is not a cure for hypertension. Well, it's not a myth. True, there is no cure for hypertension, but it can be managed with medicines and diet, thereby reducing its impact on your health, including lifestyle changes and medications. Having a well balanced low salt diet, restricting alcohol, no tobacco in any form, regular physical activity, maintaining a healthy weight, and taking prescribed medications properly. There is a myth. If you have high cholesterol, you must have high blood pressure too. It's possible to have high cholesterol without having hypertension, and that's the truth. There's another myth that all over the counter cold and flu medications are safe for people with high blood pressure. The truth is, some of the ingredients in decongestants can increase blood pressure and could possibly interfere with blood pressure and medications. Myth number 15, and it's one of the biggest myths in medicine. It's low blood pressure or hypotension. The myth is it's a disease like hypertension. The truth being, mostly it's an emergency situation developed as a consequence to some underlying condition. It could be orthostatic hypotension, also called as postural hypotension. The blood pressure falls as the patient stands up, as most of the blood is diverted towards the lower extremities. It could be drug-induced hypotension. It could be postprandial hypotension. Orthostatic hypotension can be precipitated by dehydration, prolonged bed rest, pregnancy, diabetes, burns, excessive heat. Drug-induced orthostatic hypotension could be particularly by drugs used to treat high blood pressure like diuretics, beta blockers, calcium channel blockers, ACE inhibitors, antidepressants, and drugs used to treat Parkinson's disease and erectile dysfunction. There could be postprandial hypotension. It could be because of diversion of major blood supply for the digestive process. Unfortunately, some of the patients are diagnosed as having low blood pressure by the doctors. Imagine a situation where a normal looking patient walks into the clinic, complains of weakness, and the doctor finds his BP hovering somewhere near 100 millimeters and diagnoses him as having low blood pressure. It's not a science of medicine. It's not even an art of medicine. It's a commerce of medicine. So, what is the take home message? Hypertension is a silent killer. Don't be in a denial if you have it. Follow the lifestyle modifications. Restrict salt. Restrict oily stuff. No trans fats. Eat lots of fruits and vegetables. Give up sedentary lifestyle. Schedule daily exercise. Say no to alcohol and tobacco in any form. Take the life as it comes. Relax. Stop worrying, for it takes you nowhere. Hypertension, diabetes, dyslipidemia, obesity, they are all close cousins. If you get one, another follows. And once you land up with the metabolic syndrome, it forms the basis for myocardial infarction and stroke. They do not have magical cure, but fortunately, they all have a definitive treatment. They won't go away either, but they can be managed successfully to lead a near normal life. If you like the video, give me a thumbs up and share and subscribe it. There is a lot more to come in my next video. Thank you.